opportunity. I'd like to introduce myself. My name is Deidre Reese. I am the director for the University of Illinois Cancer Center Office of Community Engagement and Health Equity, and want to just welcome all of you here for our webinar. As of right now, the chat is closed. However, we will have an opportunity for questions and answers toward the end of the webinar, and you will be able to put in your questions and answers in the chat. Please take the time to listen as we walk through the webinar, and hopefully many of your questions will be answered. Next slide. Our agenda for this afternoon is we'll discuss the University of Illinois Cancer Center. What is Hope Leaders, which is the reason that all of you are here on this call today. You'll get the opportunity to hear from some of our current Hope Leaders. So we're excited to have them with us this afternoon. We will walk through the request for applications, or RFA, and then we'll have time for question and answers. The Office of Community Engagement and Health Equity, I just wanted to spend a couple of minutes just sharing with you our office and our role within the larger University of Illinois Cancer Center. Our primary role really is to engage community with our scientists. That's our major goal. We do this in 4 different ways. We do this through outreach and education. We also facilitate research and connecting researchers with community. We also work in the areas of policy and advocacy. So this is part of our mission as we try to get community to become more comfortable with science, and our scientists to become more comfortable and understanding of the needs of the communities we serve in Cook County. At this point, I'll turn it over to my colleague, Dr. Joseph Dufresne, who'll talk to you a little bit about the Hope Leaders program.
Thank you so much, Deidre, and thank you for all your help. So what is the opportunity, right? What exactly is the Hope Leaders about? Well, the Hope Leader program is part of the UI Health dedication and commitment to the people of Cook County, especially the minorities of the Black and Brown populations in Cook County. In this program, the Cancer Center works directly with community-based organizations and community stakeholders in order to expand programming and reach our goal of establishing cancer health equity in Cook County. Next slide. So why are we doing this? Well, communities, the people, right? The power is in the people, for lack of a better way to put it. You know, our scientists, they sit at the bench. The ideas about what to study and how to tailor their science to the needs of the community depend on community members coming towards the scientists and being able to learn not only learn about what science can and can't do, but how can the community affect research goals and ensure that research at this institution and maybe others in the future are relevant to the needs of our Black and Browns community in Cook County. So last year we had our first cohort of Hope Leaders, and we had the community-based organizations that were able to be linked with labs here at UIC through the CHE office, were Equal Hope and Advocates for Community Wellness. And we have representatives of each organization here on the call with us as panelists. And they will share some of their experiences with you guys, being Hope Leaders, and what they've learned and why it's a great, why they feel is a great opportunity, and and all that good stuff. So go ahead, Gianna. I think Gianna will speak next.
All right. Hi, everyone. Good afternoon. Can you hear me okay? Okay, wonderful. My name is Gianna Calixto. I am the Director of Community Health and Engagement with Equal Hope. And what we do at our organization is provide free breast and cervical cancer screenings for individuals in the community who are uninsured and underinsured, medical home placements, as well as address social determinants of health by directly supporting transportation to and from any screening appointments or medical home PCP appointments. And so we were fortunate to be paired with the Dr. Emra Earl Lab, in which we were able to have our team go into their lab, learn about what they're studying, and vice versa, have their team come out with us into outreach events, canvassing, and share what they do with the community at some community events. So specifically, their lab is at UIC. We were able to work on over. They did an entire oh, look, I love these pictures of us. They did an entire like research project kind of thing with our team, kind of showing them what they do with their studies. They are studying how the mechanochemical signal transduction within the metastatic microenvironment impacts interactions between disseminated cancer cells, vascular stromal cells, and immunity, and in turn regulate lethal outgrowth. So they really do kind of share what they're doing and make it sound not as complicated in terms of how can the community understand what they're doing. This fostered a great relationship between the researchers and our outreach team, our community health workers. You can see in one of the photos, they came out to one of our meetings, talked about what they do and how were they going to share that information with the community so that they can better understand it, fostering just a better relationship between what historically our community feels about research and how we interact with research and the fears that just comes along with it, and understanding that the researchers themselves are just as passionate with addressing breast cancer in the same way our team is passionate, just different approaches of how to address it from different lenses. So it was lovely to get our outreach team and our navigators in the same room and really share what we do on our end and what they do on their end, and how we can collaborate.
Thank you, Gianna. Regina, would you like to speak and share your experiences?
Yes, thank you so much. I'm Regina Hopkins. Can everyone hear me? I'm Regina Hopkins. I'm the Director of Health Education with Advocates for Community Wellness. We are a nonprofit organization whose mission is to reduce barriers to health equity, increase health literacy, and we do that through the education of healthy lifestyles, fitness, and proper nutrition. We have our Cancer Awareness and Survivorship Support Program, which consists of outreach, education, and awareness and screening promotion for various cancers that include breast cancer, colorectal cancer, lung cancer, prostate cancer, cervical cancer. We also have several other programs that are centered around nutrition education, healthy cooking classes, women's health, and also mental health as well. We were so thankful for the opportunity to be recipients of the Hope Leaders Fellowship Award. During the first quarter, we were paired with a lab, Dr. Saxena's lab, that focused on looking at the research from the genetic perspective of how genetics does affect cancer incidence rates when we were looking at a study that was designed centered around zebrafish. But we are so thankful to be paired this quarter with Dr. Sun's lab that looks at the correlation between vitamin D deficiency and colorectal cancer. At the heart of what we do at Advocates is prevention, not just for cancer, but chronic disease in general. But in our outreach education, we do focus on healthy lifestyles to prevent cancer, but most importantly, we emphasize the importance of early screenings and how early screenings do save lives. So we are looking forward to this quarter where we're going to be able to get into the lab with a new group of research scientists, specifically looking at the impact once again on how vitamin D deficiency is there a correlation between vitamin D deficiency and colorectal cancer. One of the things I would say that I appreciate and have been able to benefit from as being a recipient, or advocates has been able to benefit from and being a recipient of the Hope Leaders Fellowship, is just the connections, the collaborations, not only with UIC um, Cancer Center, but also being connected with other resources that support our programs. We've been given the opportunity to receive a lot of resources to expand our outreach, as well as being able to receive connections to other funding sources to be able to support the work that we do. So we are excited about this quarter and getting into the lab to learn more um, about the research that's being done in Dr. Sun's lab, and most importantly, the impact that this program has, as Gianna had stated, just linking the community to science, because we know in the African American community and the Black and Brown communities, there is a stigma that's attached to research. So our hope and our goal is that we can work together so that we can bring the community to the lab and bring the lab to the community to be able to produce better health outcomes.
Beautiful, beautiful. Thank you so much, Regina. Thank you so much, Gianna. Uh, so, as Gianna and Regina so eloquently stated, you know, this program is about the community, and especially this half of the program is all about community-based organizations who are, especially community-based organizations with a certain amount of time in their community, have built up a certain amount of connections. Faith-based agencies are also, and public agencies are also invited to apply. We do not want other academics and universities applying. You know, this is extremely important that this part of the program be community connected folks. You know, we definitely, we're all educated, we're all colleagues, but we at the Cancer Center, we want to know what the community has to say about what we're doing. We already know we're smart. We need you guys to tell us how to get better, how to get smarter. Sorry, next slide. So the award will be $20,000 over 2 years. The first, upon successfully competing for the award, the first $10,000 will be dispersed. The second $10,000 will be dispersed dependent upon first year progress. That money will be used for events and other activities that will share the information learned from the cancer biologists in the laboratory and share it with the community, as well as also ways of facilitating the basic researchers themselves being able to be in the community and communicate directly with community members. Next slide. I think next slide is the application. I believe now our director of CHE, Deidre Reese, will take over to describe the actual application and how to fill it out. All right, Deidre, go ahead.
Thank you, Joe. So now I'm going to walk you through the application, and really I'm planning to highlight those things that I think might be the parts that people may forget and or miss. So I'm going to try to walk you through screen by screen so that you understand the application process. We have really tried to be sensitive to community. We've tried to make this as simple and as streamlined as possible. So first off, where is the application? So we will be sharing some links, and we have shared some links with you, but we wanted you to know that you can find the application if you go to our Cancer Center website. And I put our website link up there. If you're unable to get to the link, if you go to University of Illinois Cancer Center and you search for Hope Leaders program, the Hope Leaders page will come up and you'll be able to find the link to the application. The other place is the REDCap link. Both of these links will take you eventually to the same place, but I wanted to share both of those links so that you would be aware if for some reason you couldn't get to the link directly. If you go to University of Illinois Cancer Center website and look up Hope Leaders or search for Hope Leaders program, a full page will come up with all of the information, and you will be interested to look for the community partner application. And there's a red cap link, which is where the application is embedded. And that's the link there. So once you hit these links, you're going to come to the next screen. And this is what you'll see. This is the screen where the application is, where you would apply. As you can see, at the top, it has the title. The application deadline, I want to iterate, is April 30th, 2024. The project length for this is June 30th, 2024 through May 31st, 2026. So this is a 2-year project. So I want to make sure folks are aware that it is over a 2-year time frame. And then there is this Word document that you're going to find inside the application. That's where the request for applications is. So please note, that's where the red arrow is showing you. This is where you will find the actual request for application that lays out all of the information that we're talking about today, what you need, the criteria, all of that information is laid out. It's about a 5-page document that lays everything out so that once you view this document, it tells you everything that you need, and then that will help you to go in and put in the application. This is what once you download the Word document, this is what will come up. This is the document here that lays everything out. And again, it just goes over the grant award, the funding, the timeline, the project length, when we plan to communicate decisions, the purpose of Hope Leaders, everything that we've been talking about in this webinar. This document is your guide to this application. So please make sure once you hit that link, you want to go to the Word document that's at the top, that's attached, download it, and really read through it so you can understand all of the aspects of the application. Now, at the end of the request, the RFA document, you're going to find this application rubric. This application rubric is really important because it's really a summary of everything you need for the application. So there are 12 questions total for the application. The first 6 questions are not scored. You don't get a score on them, but they are required. And these is your basic demographic information, who your organization is, how we can contact your organization. Question 6 is very important. Are you a current vendor of UIC? So in other words, do you have any current contracts or grants with UIC? If so, then we're asking you to share your vendor number. If you're not, that's fine. We will take you through that process if you are awarded, but that's what that question is about. If you don't know if you are, you probably are not. So this rubric lays out for all 12 questions what's needed, what the question is, a description, what do we mean by that, and then what the points are. So for this application, it is split into 3 sections. Part 1 is your organization information. While it is required, there is no scoring of that section. Next slide. Then there's part 2. Part 2 is your program description and rationale. This is where scoring is determined by what you put for questions 7 through 11. All of those questions are scored. They're 5 points each. So if you take nothing else from the webinar that I say today, please note questions 7 through 11 are the questions that will be scored. Please note, for each of those questions, there is a word maximum. So for example, for question 9, staff who will participate in this project, the maximum number of words for that is 500 for that question. No more. You can do less, but no more. So please note in parentheses, that is the maximum number of words per question. Each of these questions is weighted at 5 points each for a total of 25 points. So please make sure to read through this section carefully and make sure you're very thoughtful in your answers, as this is where the scoring of the application takes place. It's questions 7 through 11. And part 3 of the application deals with the budget. A budget is required. It is not scored, but it is required. Item 12 in the application is the budget justification, and there is an attachment as well with a budget template as well as budget instructions. You need to complete the budget template and then upload it into the application. So as you get to the last question, this is the last question on the application. Remember, I told you there are 12 questions. The 12 questions in the rubric align with the 12 questions in the application. So if you follow the rubric, it literally walks you through the entire application. Here, what I would like to stress to you is at the bottom, when you get to question 12, you'll also see an attachment there. That attachment is the budget instructions and a template for completing the budget. We would like all budgets to be completed using this template. And as you can see, I have another arrow on the right. That's where you will upload your budget once you have completed it. So when you're getting ready to do your application, please make sure you have read the RFA. That was the Word document that was at the top of the application. And then also make sure you have read through the budget instructions, the budget template, and you are prepared when you turn your application in to upload it to the application. And as you can see, this is where it's located. When you open the budget template, this is what you will see. This is what the budget template looks like. And so you're going to complete all sections of the budget template to the best of your ability, and this is what you will upload this into your application. I wanted to spend a few minutes talking about allowable and non-allowable expenses, and all of this is laid out in the RFA. It is also laid out in the budget instructions. Allowable includes things such as supplies, salaries, rental space for events, consulting fees, and travel. Things that are not allowed include equipment, any types of equipment, construction, renovation, maintenance of buildings, recruiting and relocation expenses. Those things are not allowable in this application. So please make sure as you go through your budget that you make sure that the things that you are include things on the left side and not things on the right side. Also note that the budget and budget justification must be provided, and 10% of the $20,000 can be allotted to indirect costs. So we know that some organizations have an indirect cost rate. The max indirect cost under this application is 10%. So in this case, $2,000. But your total should not be more than $20,000. The total of your application cannot exceed $20,000. That includes your indirect costs. And again, the link to the budget instructions and the budget template are in the bottom of the application. So once you get to the application, everything you need is there. Just make sure you're paying attention and you're downloading the information that you need. And this is how applications will be evaluated. We have a panel of reviewers that will be reviewing applications. I want you to also to know that our panel of reviewers are other community-based orgs as well that help us in scoring these. So think about that as your audience. There will be some community-based org persons on our panel, and there will be some scientists on our panel, because we try to model what we're trying to create in community. So the ranking system, 1 means that they feel that this strategy is least impactful. to 5 the most impactful. And as I showed you previously on the application, those questions 7 through 11 are those that are scored. 5 points is the maximum. 5 points is the minimum, 25 points total is the maximum. Each section of the application knows how much weight each question has on your score, and you saw that in the rubric. The higher the score, the more competitive the application. And I'll turn it back over to Joe.
All right. Thank you, Deidre. Thank you so much. So here's the link where the applications are located. Applications are due by April 30th of this year. I would like to state, of course, obviously, I'm a cancer biologist by training, so it's extremely interesting to me and very valuable to me, the idea of community stakeholders like yourselves being involved in determining basic cancer objectives and projects. Obviously, that's not what you do right away, but learning how to do that is what this program is all about. And that work helps the scientists. As far as your community organization, as street cred, when you're able to take the basic researchers from this top-notch research organization, have them come with you into the community with you, that as street cred to your community-based organization. Also, as Gianna and Regina stated, the connections you will make over the next 2 years working with us should greatly help the community-based organizations programming, as well as the chances to meet the chances to have access to new resources. So I really encourage everyone on the call to please apply. If you have any other friends or of any other community-based organizations that could also successfully compete for this, we encourage you guys to please spread this RFA wide as you possibly can. And thank you again, everyone, for their time. We look forward to seeing and reviewing your applications and being inspired by all the great ideas that you guys have. Thank you. Any questions?
So if people have questions, you're welcome to put the questions in the Q&A. Q&A should be open, and you can put questions in the Q&A, and we'll do our best to answer those questions. We will also try to have a copy of this on our website for people to come back to if they have questions about the application. Questions?
So, do you mind if I talk a little bit more, Deidre?
Go ahead.
Go ahead, I can talk. So, this program is very exciting, right? I don't know of another program where we have community-based organizations coming into the laboratory, learning about the science that's happening there, and then being allowed or even encouraged or actually, oh, there's a question again, sorry. Well, real quick, to actually determine what the research will be. And I think that's very exciting. Okay, so the question, let's see. How many grantees will there be? So how many grantees will there be? I believe the answer is 2 from the community-based organization side, and then we're gonna have 2 laboratories. We have a separate RFA for cancer biology labs at UIC, and they compete for 2 spots, and then we link the lab and one community organization, and we link another community organization and another lab. So 2 spots, I believe. But like I was saying, so it's so exciting to really start. Community-driven basic research, is a holy grail that I think that, I know that I'm very interested in helping our institution to achieve. We're ready to do a lot of community relevant research, but community driven is a mantle we have not achieved yet. And this program is a part of a continuous step, like a continuing programming. So before me, there was the community to bench program that Yami started. We added a bidirectional portion. Okay. Second question: if the deadline is 4:30, will organizations have notice of acceptance or rejection by May 30th?
And so I answered that our goal is to have our decisions out by 6/1/2024. Other questions?
Yeah. Any questions? So, so then we continue to build as an institution. CHE here at the Cancer Center and Cancer Center at large continues to build increasingly closer connections to the community, not just with basic research, but also with clinical research. But this program focuses more on basic research. So thank you, everyone. Are fees for health fair type events allowable?
Okay, so let me try to answer those questions. Are fees for health fair type events allowable? Yes, I would say they are. Yes, I would say yes to that one. In terms of, is consultant fee the same as stipend? We don't use the term stipend. So for this application, anything would be considered a consulting fee. I hope that answers the question. Other questions? We'll give you all a couple more minutes if there are other questions that folks may have. We hope that we've given ample opportunity and time for people to get the applications in. In order to submit an application, you do not have to have attended the webinar. So if there's others that would like to submit an application that are not able to attend the webinar, they will still be able to submit an application. Let's see, is there another question? Looks like we don't have any other questions. I hope things were clear, but you still have the opportunity now if you would like to submit a question. We want to thank all of you for your time and for attending today and taking the time out to learn more about this opportunity. We're excited because as we move forward for the 2024-2025 cohort, our first cohort that you met earlier, they will be going into their second year, while we will be starting a new cohort as well. So we look forward to seeing all the connections that are made between the different cohorts. So someone asked the reason why the responses for questions 7 to 11 are only 500 words. Really, we have really been trying to decrease the burden of the application. We were trying to make the application as straightforward as possible. We know for other opportunities, oftentimes there are far more criteria, far more words needed and things like that. So we're trying to make the process as easy on both sides for both the community-based organizations as well as the reviewers. And so we hope that people can, as best they can, succinctly discuss their organization and what they bring to the table. Last year there was so I've answered that. Last year there was an opportunity to submit letters of support. Is that an option this year too? No, that is not an option this year. This year we are not doing letters of support. That's one less thing people will have to worry about submitting. So no, we do not need letters of support this year. Based on feedback, we've been trying to make this process easier. So no letters of support are required. But I encourage everyone, please follow the rubric, and the rubric really just lays it out for you. We've tried our best to streamline it, simplify it, but still get all the information that we need. Yes, this is my email on the screen, Deidre Reese, but my email is dturne1@uic.edu. So please, if you have questions about the community application, please feel free to reach out. We'll do our best to get those questions answered. We also would encourage you to visit our website and learn more, not just about Hope Leaders, but all that is happening at the University of Illinois Cancer Center. And it's so nice. I see some very familiar names and faces that I worked with in the past. So I wish everyone the best of luck on this application. Okay, we're going to give it another minute or two to see if there are any additional questions. Okay, if there are no other questions, I'm going to thank everyone for participating and wish you all the best of luck in your applications. Thank you.